Life is both simple and complex. Our past links us to our present and future. Some of us know our role and purpose. Most of us are trying to figure it out. Join me. Let's figure it out together.
Welcome back. My name is Fritz. I'm a psychologist practicing in Manhattan and in Staten Island, and this is the program that brings psychology, the psychology of everyday life to you. Each episode will feature guests, topic, and issues that are affecting our lives. Today I have in the studio with me Jamie Hickson, is that correct? And he has his own show on CTV. We'll be talking about his show at some point, but first, let me talk to you about the topic we'll be handling today, which is we'll be talking about suicide and suicide prevention. And Jamie, I'll let Jamie talk to us about why he's here and why I wanted him in the conversation. But let me first start by when I'm saying when we approach this topic, suicide, I want to talk about it from the perspective of prevention. Every year, many people are affected by this. In 2010, I think the statistic was about 38,000 people in the U.S. alone took their lives through suicide, and a lot of that could have been prevented if we had programs that provided information about where people could go for resources, for help, because there's a lot of it out there, and there's a lot of information that we have to share about it. In this episode, I wanted to talk to Jamie about surviving a suicide attempt and living with depression beyond, so that people out there who may have been affected by this know that there is hope, that they can do very well in life, and that if certain things are in place and they have the supports that they need, they can really thrive. So, Jamie, I want to welcome you to the program.
Hey, what's up, Doc?
Thank you. You wanted to just say that.
Yes, I did.
Well, thank you for joining me. And you know that in my day job, I work as a psychologist. I work with individuals, and they often come to me for a variety of reasons. And when they're doing well, they're doing well. And when they're not doing so well, you know, they might be experiencing anxiety or depression. Some may having thoughts about wanting to hurt themselves. And because they're in treatment, we're able to generally keep them safe and connect them to the right places where they can go to recover and to live a happy life. Let's talk a little bit about what your experience of that is, and I'll let you kind of start that narrative in terms of, you know, you're a survivor, and can you describe what that is from your point of view?
Well, first of all, thank you so much.
You're welcome.
And second, all praise and glory goes to Almighty God for allowing everybody to be here, to be part of this. As far as my life story, long story short, I've been dealing with this problem probably since I was around, I would say 7 or 8 years old. There would be moments going as far back when I was a kid, I would just burst out crying for no reason. It would occur in class, it would occur during playtime, and as the days and years went on, they improved a little bit, but I always had these moments where I felt so alone, like I didn't know who to turn to, what to do. I was not going to go to my parents because unfortunately there's a history of suicide in my family, and if I spoke to them about this was really going to touch a nerve with them.
Now I was just about to ask you about that. You're 7 or 8 years old, you have these moments, Jamie, where you're feeling something. One, I want to ask you about, tell me more about what that feeling was like, and then what did you try to do in terms of reaching out for help? But first, what was that feeling?
As a kid, that feeling was nothing but despair. I would just have my moments where I would cry in front of the entire class, and in those days, it was because I missed my parents so much. Every time a kid would start out in school, they always have this thing where they were afraid that their parents would leave them for good in a particular school, and that's how I felt. I felt like I was never going to go home again.
So you were a 7, 8-year-old kid that would have these feelings of despair, feelings that your parent, was there something that happened that precipitated that, or is that something that that feeling that you just thought?
There was a lot of domestic abuse between my parents. Sometimes it would be between the two of them, sometimes it would be between them and I. It was a lot more mental and verbal abuse than actual physical abuse. I mean, there was some physical, but anybody who tells you that old saying, sticks and stones and all that other good stuff, total lie.
Words hurt.
Words hurt, and they can sting badly.
Right, so you were a young child in basically an abusive situation in an unsafe home, and you would have these periods where you'd feel really, really bad, and I gather then that home wasn't the safest place for you to express. Did you try? Did you try to talk about?
I couldn't do it.
Not home. Did you try to talk to anybody, a teacher, a friend, a guidance counselor?
As I went into my college days, I did. There was a counselor at St. John's where I graduated from who was very, very helpful when it came to the problems that I had with my parents specifically. In my case, the problem was my parents were a little bit more controlling of me and my life than they really should have been. I mean, we know how parents should be. They should be involved in their children's lives, but not to the point where they have to dictate anything and everything into their 30s and 40s. I mean, that should be the age where kids should be able to fend for themselves. But a guy like me, living with his parents until they reached 40 years of age, all I ever heard was, why couldn't you do this or that? You should have done this or that. Why can't you be like this guy? Why can't you be like your father and work on the docks?
Right.
That's not me. Every person is different.
Right.
But my mother just could not see it like that, because they're from the old school. Mom and Dad, they're from the old school of how things work. Their thinking is, well, because we're a family, the family should be together regardless. I was born and raised here in New York. As an American citizen, I feel we should be able to explore our own destiny. And my parents just didn't see that way.
And so you felt like you were in a very restrictive and limited environment. You were unable to express yourself, be who you are. And so from a very young age, you remember being unhappy, being unmiserable, being sad, depressed. Home wasn't a place where you could express yourself.
No, not even.
What could have people done to help you during that time? And you can, either as a young adolescent or in your teen years, was there ever a point at which people who were professionals or teachers, did they approach you to ask, Jamie, how are you doing? What's going on? Did they notice that things were going on with you?
My college counselor asked me that all the time, and he was a real pro at it. But it just didn't feel like it was enough, because if it wasn't the abuse at home, it was the constant racial slurs I was getting in school, or outside of school, it was the constant ridicule. It got to the point where I just got so much abuse that I didn't really know who else to turn to if it wasn't my college counselor.
And when you did turn to your college counselor, first of all, at that point, had there ever been thoughts of wanting to hurt yourself?
In those days, no. I really didn't think of that kind of thing. But as I got older, that's when things really went from bad to worse. The living situation with my folks really had a lot to do with it. Plus, as I started exploring relationships with women, there would be this thing where I'd get a little attached to them, and sometimes it would maybe scare them off a little bit, but the first probably really serious relationship that I had, which became an engagement, was with a young woman who at the time was married and also was a mother to 5 children. And she, like myself, was the product of abuse, but her abuse was progressively worse. She was the victim of physical abuse.
Do you think part of how you guys came together, given that you had similar backgrounds, were because of those similar backgrounds, and that you may have been seeking out one another for some kind of mutual support?
That had, I would say, 90% to do with it. 90% was the fact that we were both products of abuse. Another part was we really did love each other. And we loved each other to the point where I would financially support her and her children. And we came really close a couple of times to starting a life together. But unfortunately, her family brainwashed her into thinking that things were going to get better with her husband when they really were not. And then the next thing I knew, I would go weeks, sometimes even months without hearing from her, and it really hurt me. I mean, here I am. I thought for sure that I finally found the one, and it turns out her family wanted nothing for her to do with me. And that was when things really, really started to snowball for me emotionally.
Okay, and so things got worse there. But prior to that time, had you mentioned having a guidance counselor. Had you been in any kind of ongoing counseling, any psychiatric treatment?
Mostly when I was in college. Anytime that I would want to go to see him, all I'd do was just make a simple appointment. And sometimes I felt a little afraid of really revealing what was going through my mind and my heart, because I was concerned that maybe he would want to get my parents involved and things would get progressively worse. So I would really hold a lot of stuff within me because I just worry about my parents' reaction.
Right.
There has been suicide in my family.
Yes.
I had an uncle who committed suicide before I was born. I had a cousin who committed suicide when I was about 12 years old. Suicide within somebody's family is a total shock to the system.
Yes. And let's take this moment too, because there are a lot of risk factors for suicide, and one of them you're highlighting is a family history of it, or knowing something, or someone, or being close to someone, or having even a schoolmate. Whenever there's a suicide, usually there's some kind of there's an effect where it, as you said, a total shock to the system, especially if it's in your family. Other factors could include emotional, physical abuse, sexual abuse, violence, bullying, mental illness within the family is also a predictor of suicide.
It's funny you mentioned bullying, because I was the victim of a bully in my high school days for 3 years straight, and that bully was a former friend of mine, and there was a bit of a disagreement. It was mostly my fault, but because of that disagreement, he just terrorized me for 3 years, and even now I could still see this idiot's face in my mind, and I had to go through 3 straight years of just hoping not to see this guy. That way I could just pass through the day without anything happening to me. But this guy was just there the entire time, and graduation was when I finally felt like I was free of all this bullying.
And so one of the also more powerful residual effects of ongoing bullying, and it's an ongoing abuse, physical abuse and trauma, leaves people in terms of their self-esteem feeling more vulnerable and lower, and you started to talk about when things started to balloon for you. So let's go a little bit, talk a little bit about that, talk about maybe what you did about it or tried to do, or even warning signs that might have been missed.
Yep. Things got really bad when I became what I would say probably in my 30s. Late 30s was when things got really, really bad.
Okay, what do you mean by really bad?
By really bad, I mean I would just go into the office or any place else, and there would be nothing but a frown on my face. And I really had to do a lot to try and mask what I was really feeling, until somebody asked what was going on with me, and I finally had to open up the truth to them, that I was going through a situation with this young woman, and I was a little concerned that I might not be able to see her again because of her situation. And as it turns out, as time went on, we wound up breaking apart and breaking up, so we never saw each other again. But the hurt, especially the hurt of her and I being apart, that was what really, really set me over the edge. I just could not stop crying. And I kept wondering, what is going to happen next? Praise God that the young lady that I'm now with, who I also went to high school with for a couple of years, we've known each other for over a quarter of a century, was there to try and get me through this whole thing. And ironically enough, it was because I'm with my current lady where the suicidal thought started coming into place, because in addition to me supporting my ex, I also wound up supporting a daughter that I adopted when she was a teenager. If I had to do it over again, I would still do the same thing, because without me, this young girl would probably be dead. She needed someone to be there for her. I was the one that got her through college. I was the one that got her through her son's open heart surgery. I was the one that got her through everything. Without her, she would not be here right now.
So you played a big part in her life too.
Yes, I did. And I just wish I had gone about it differently. That's another thing that I have. I have major regrets about a lot of stuff that happened in my life that I wish I could just start over again.
And do differently. And when you said before that you were walking around with a big frown on your face, would you say at that time you were experiencing full-blown depression?
Yeah, it was definitely full-blown depression.
And it sounds like with all the things that you've been through, you also probably, there's a lot of trauma, a lot of stress, and as I hear you say that you wish you had done things differently, probably the way that things were going for you were also an extreme mental strain upon you.
The entire lifetime of episodes that I went through, the bullying, the abuse between my parents and I, the constant ridicule, the put-downs, being apart from people who I cared about. And it's not just the women in my life, it's my family that's outside of the New York area. Every time I would go down to visit my relatives in Florida, those were happy times for me, because it really felt like it was one whole family together.
Yes.
And every time my parents and I would come back, I would just have those feelings of loneliness again, because I never ever had that kind of feeling when I was with my Florida family. My aunt, my cousins, my sisters, it was one big happy family. But every time we would make our way back here, it seems like the problems that we had would just rear their ugly heads again when we would have to deal with them.
So it sounds like you kept going back into over and over again a stressful and traumatic and abusive situation.
Yeah.
Now, I want to highlight that you're here, so you're a survivor. You want to talk a little bit about even what I mean by survivor? What happened to you between now and then for us to call you a survivor on a program about suicide prevention?
The thoughts of suicide that I had when I was younger, I didn't really act on them. But when everything started to gang up on me at once, that's when I thought to myself, why am I even here? Why don't I just go away? That way, no one would ever have to put up with me ever again. So a couple of times when I was at my fiance's place, I would just get so fed up and so overwhelmed that I would just race into the kitchen and get a butcher's knife. And I actually came close one time to slicing my arm open, because I felt that there was just so much pain that was going on inside of me right now. What's a little physical pain to add to it? But it just got to the point where I couldn't deal with all of the drama anymore. And it's a good thing that my lady was there to stop me both times, because if not, then it really could have gotten ugly.
All right, and so it's important to note that then when this happened, you weren't alone.
No, I definitely was not alone.
It did come on as an impulse, but the thoughts had been lingering, and that there was someone there who cared about you to stop you.
Yeah. As it turns out, the lady that I'm with right now, she and I have one big thing in common. She and I have been products of abuse as well. Her husband abused her for 10 years. Her dad abused her when she was a kid. Even to this day, I still become the brunt of somebody else's frustrations over just stupid little, petty little things that never really should be dwelled on in the first place. But praise God that the woman that I'm with right now was there to see me through all of the crying episodes that I had, all of the problems that I had with my parents, all of the other issues that I had. She was the one that convinced me when 15 years earlier, I never would have considered such a thing. She was the one that convinced me to get help, go to the hospital, whatever amount of time it was going to take for me to be better, it was going to happen because I did not want this feeling anymore. No individual should ever have to go through the pain and the abuse that I have gone through, because it is just not worth it.
And so I want to reiterate what it sounds like that was life-saving and helpful to you, obviously, is having people around who loved and cared about you that were there to hear about what was going on with you. Because it sounds like earlier on in life, you weren't feeling so good and you didn't have much of an outlet to talk about what was going on with you. Not much of a space for people to be able to keep you safe and allow you to express yourself, be who you are, and respond to you in a safe and sound way. And then when it really got bad as you got older, it sounds like the depression even hit harder, and it went from just thoughts to at times having the physical action to go do it, that there were still people that are around. And I want to highlight that, you know, depression and suicide is very preventable if we are involved in each other's lives to the extent of allowing them a safe place to express themselves, allowing them a space to talk about what's going on with them, and asking the question, do you have thoughts of wanting to hurt yourself, and not being concerned that you're going to put that thought into someone's mind. We need to be available to one another to share in the pain and allow you to express yourself. And I think that's why you're here. Would you agree?
This is so true. Even now, I still have my moments where I can really hold things back because I'm the type of person who feels that it's best to leave certain things unsaid because it's only going to cause more conflict. But my lady keeps on telling me, talk about your problems more because holding it in is no good. Thank goodness, praise God, this woman has been around. She's my guardian angel. Even through all of the problems that she and I have had together, and we're going on 6 years now, she has been there. She's been there to arrange my budget. She has been there to help me in my hospital episodes. She has been there to deal with my problems involving my parents. She's just been there. And I want to say how proud I am to be the man that I am right now, but I just still have these regrets where I wish that I had done things differently.
Is one of the things that you wish you had done differently was seeking help in a different way?
Yeah,
or?
That's definitely one of them.
Okay. Can you talk about more about that part, though?
Yeah, I
there
had wished.
There are a lot of people watching who may not have such a wonderful person that is there for them like you have. And I really want to make the point to people that are watching that if you don't have that someone that's close by, there are an enormous amount of resources out there.
Yes.
And there are professionals and their organizations and their agencies that are out there staffed with people who are trained to really be there to listen to you, to ask the question, and to provide the support and the resources and the treatment necessary. You don't have to go through this alone. You don't have to hold on to all those thoughts alone. There are people out there who can hear it, who can contain it, who can really look at you and care for you and do what is necessary to help you get through a tough time. Because obviously, that's what's happened for you. Someone was there at a critical moment in time to be there for you, and that's why we can call you a survivor. That's why you have a great show, a couple of shows that I've seen you on, and doing wonderful work at the station.
Thank you.
And are probably impacting many lives positively through, your survival.
It's a good thing that I have my job also as an outlet because this has become my second home to me. Whereas I'm now living with my fiance, this has become home for me. My bosses, my coworkers, a whole bunch of producers that I go back 10 years with, they have been a joy to work with and to talk to. There are even a couple of guys over here who've gone through progressively worse situations than I have, and it puts everything in perspective when you think about it.
And very, good to put into the perspective of that you are here. We often, in the media, only are talking about people after they've done it, and it's more of a sad, tragic highlighting of that story. And that's why I really wanted to have you on, because you're the story of somebody who has struggled with it and still struggles with it, but has put in place a structure around you. And I hope that structure is working. And,
Yeah.
you know,
It is. It really is working.
and so people are checking in on you, and you finding a safe place in your sphere of social support where you can talk about what's going on with you and prevent yourself from going in the wrong direction. Is that correct?
Yes. In fact, they keep on telling me if I need anything, they're just a phone call away. I mean, granted, I see a couple of doctors and also a psychologist, but they have been more than helpful with me. And if it's just a matter of medical bills, I mean, they will work with you. You just got to really be open to wanting to discuss your situation, because I had that problem. Sometimes I feel like I still have that problem of holding back. But just bring out stuff one by one, because if you can do that, then you'll be saving yourself a whole lot of abuse, and you'll be saving yourself a whole lot of pain.
Okay. Now I want to thank you for coming on here.
It's my pleasure.
We're going to have in the show notes and the credits information. I think the 1-800 number for suicide prevention is 1-800-273-TALK, T-A-L-K. You can call that number 24/7. There are a lot of agencies that exist out there, no cost, where you can make those phone calls and get the help. On the internet, there's a lot of resources, too many to even just talk about, but government websites have frequently asked questions. On Staten Island, we have the Staten Island Mental Health Society, and they're a great resource. There's so many places where people can go, psychiatric emergency rooms or emergency rooms in general, any mental health professional. They have a dedication in terms of their profession to help people that are in need. So the support is out there. And I want to thank you for coming on.
My pleasure.
And any closing thoughts? We've got a few seconds here.
Bottom line, if you're going through something, please get help. If you know someone who is going through the same situation, you must help these people, because if you turned a blind eye, there will be regrets, and there will be a major void that will not be filled.
And you don't want to ever be in a situation where you could have done something, and is just being a warm and empathetic listening ear is important. And then if you recognize that somebody is in crisis, the kind of crisis that definitely needs a mental health professional, don't hesitate to let a friend know, let a family member know, healthcare professional, get them involved. You don't want to be on the other side of having seen something but not said something. 1-800-273-TALK, T-A-L-K. That number, even if you're not the person that is in distress, you can call that number and ask them questions in terms of what you can do and how you can get that person help. They've got